So thanks to all four panelists for sharing, again, a wide array of perspectives on thinking about evaluation and assessment. We only have about 10 minutes left before lunch and our keynote speaker, which will give us an opportunity for one or two questions. So if you could throw your hand up high, someone will bring a mic over to you. I see. Yes. Rich.
Really enjoyed the presentation, and I think that Jenny, Neil, and Charles made some very interesting points about measurement and data analysis, but being kind, nice people, they didn't drop the other shoe, so let me drop the other shoe. We know very little about the actual effects of after-school programs from the standpoint of measurement and data analysis. You all made these points, but let me bring them full circle. We don't do cognitive interviews to understand the meaning of the items to kids. And then when we get those items, we really don't do invariance testing. We are trying to look at intra-individual change, and I'll come back to that in a second. We're trying to look at intra-individual change, but we are not testing for even that level of invariance across time. There's a very important article that just came out at DP that child development did not have the courage to publish. Jackie Eccles had the courage to publish it. It was written by Greg Duncan and his colleagues. And it talks about the fragility of the findings we have in programs like the ones we're discussing. There's virtually no replication in our field. What we sometimes have is meta-analyses, but meta-analyses are addressing a different question. They're addressing the question of what is the effect size across studies that have been published and that are using different methods. Replication says, what is the consistency across studies attempting to use the same measures and methods? And of course, we don't publish those very often. Greg also makes the point that we know very little about the robustness of our findings. How many studies of the effects of out-of-school time programs or after-school programs look at different estimators of their data sets? So we will do an analysis, but then we won't use, or we might use a regression method, or even if we use propensity score matching in our analyses, do we then go on to do instrumental variable analysis, or do we do subgroup analysis to see if our results hold across race and sex? Typically we do that. What about religion or family structure or parents' educational background? So we know very little about whether or not our findings within a study are robust. Finally, because I don't want to take the whole time, and I'm going to be talking about this tomorrow, we need to get away from analyzing means and standard deviations and look at intra-individual change. Folks, all the statistical analyses we are using are based on a set of mathematical ideas called the ergodic principles. John Nesserode here at UVA, Peter Molinar at Penn State have repeatedly pointed out that the assumptions of those analyses is that there's homogeneity across all members of a sample and stationarity across points in time. If you violate those assumptions, then you can't calculate a mean or standard deviation. So we're looking at ergodic measures at different points in time when we should be looking at intra-individual change. And when you do that, you see that the intra-individual trajectories do not at all map onto the mean levels that we are claiming we're studying. So we really need to do a much more sophisticated and detailed job in measurement and data analysis. And we need to hold ourselves to a higher standard if we're really going to affect policies in this country.
And the thing I just want to talk about with the first thing is measurement. Charles says nobody looks at items. I'm one of those crazy people who loves items. And I wish people would just stop trying to develop a new measure. And we come as a field, and the school field's finally gotten to that place, the out-of-school field, saying, let's just all come to agreement, because you can't compare anything. If you look at the items, it's really quite scary what we say we're measuring. So I would just want to echo. that, you know.
So I'm guessing you must be Richard Lerner. We've not met, but I'm guessing from your comments. I appreciate all of them. Although the one thing I would say is that ultimately it's a question about what draws resources to the work. And if the resources are drawn locally, just being able to say, hey, we're being accountable, and I'm not going for the average effects, and I'm not going for the sophisticated statistical model, but I'm going to take these bits and I'm going to use them in a clinical sense with local actors in the very small samples, N of 1, 2, 3, 4, 5 staff at the program, that it's our experience that building these quality systems and using data in that formative sense allows people to stand up and say, hey, we're being accountable, and it draws resources over time to those systems and to that work. So I totally agree with everything you had to say, and I'm glad we got Neil around to work on those problems. But just the fact of the kind of the more clinical diagnostic use of the data in a systemic way, I do believe draws resources in the sense of funding to the work.
And I have to agree too. I mean, every point that Dr. Lerner is articulating is completely relevant and appropriate. I think we're struggling with this standard right now of trying to respond to the questions that folks want to have answers with the resources we have available, but that doesn't excuse us from getting to the standard that would be able to answer the questions that we're looking at. So we're continuing to try to work on that vein. We're not quite there yet, but everything you've said is I can't take issue with.
All right, so I'm told we can take one more question, and I see somebody's already got a mic. So if you could introduce yourself first, and then.
Okay. I'm Sandy Simpkins from Arizona State University. And my question is actually related to Rich's, that I study Latino families and youth and why they go to programs and what they think about programs. And it struck me during your guys' talks, and it struck me with the panel this morning, this balance between universal needs of youth versus adapting a program or the variety of outcomes you get depending on where youth are at, where their families are at, and what youth need. And so, I have this question partly because I see the diversity in the families I'm talking to, but so from a research standpoint, I think it's something we need to look at, which is some of the point of what Rich brought up, but also from a programmatic standpoint, I'm working with some of the organizations in Arizona, and they're asking me, how do I adapt my program to every kid that walks in the door? My program is meant for kids of all these different groups, or maybe it's one ethnic group, but they're very different kids, in their orientations and immigration and these. So anyways, it was just an issue. It struck me here in terms of measurement and outcomes that there's a range in your outcomes, or there's a range in what these kids need. And so your thoughts on balancing diversity versus universality.
Look at me. It's hard because it depends who you're talking to. And I'm struck by Neil's, the policy world, what they care about. And if we really want to make policy changes, we have to talk to that world. And as much as I totally believe in universality, but that's not going to get the kind of the funding. So I think for that kind of situation, you need these. Let's come to some more congruent universal measures that a policymaker will listen to. Now, at the local level, that's a different argument. So I think who are you talking to and for what reason is going to determine how much diversity of measurement. I worry, I'm all for diversity, but I don't think we even have agreement on universality yet to even get to the diversity question.
So are we running out of time? So I wanted to get something in here real quick. So I'm going to step in on this. I'm Patrick Toll, and I'm a director of the center. And I just want to say I am so glad we're having this conference because this field, at one hand, is either in a big mess or is on the verge of a transformation that's really powerful. So I wanted to interject at this point to take my perturbance and presume it's a universal experience and ask you to think about what's perturbed you this morning and to really follow that through with some of these colleagues here to do some work because both things are true. We don't know anything about how this works and we've got clear evidence it works. So we need to reconcile those in some way. So I thought as we transition to this next, from the first part of the morning, just ask you to follow your perturbance up into action. Find somebody and stick with them and keep going after the conference. Thank you.
Thanks, Patrick, and I want to thank all of our panelists for this session. Please keep in mind that during breaks, you can follow up with them individually, as Patrick suggested. And now, before we break, I'm going to hand it over to Nancy Deutsch.